As of today, we are about to announce that we have a fourth case. And I will say all of our cases are either travel related or it's a direct connection to someone who is a confirmed COVID-19 case. This is not the time to drag yourself to work. If you're not feeling well, we want you to stay home. We also want people to do things like wash your hands. The difference in this COVID-19, if you have it, there's really no clear treatment. It's not like we have a clear path and we can say today, oh, we can give you this medicine and it'll make you feel better.
Okay, it's March 26th now, and we are with Jennifer Greene. Jennifer is the Health Director at the Appalachian District Health Department, which serves the entire High Country region. Are you in 3 counties? Is that right?
Yeah, we're in Alleghany, Ashe, and Watauga Counties.
So you, in a lot of ways, are kind of on the front lines of this COVID-19 situation, and so I'm really thankful that you're giving us a little bit of your time to tell us what you're seeing out there and helping us learn about how we can stay healthy as individuals and as a community. So thanks for being with us. First question I kind of have for you is, I don't know if others are thinking or feeling this way, but sometimes I feel like as a small mountain community up here, we're insulated from this problem. I don't know if that's true or not, but I think it's easy maybe to feel that way. I'm curious of your thoughts on that.
Yeah, I think that we have such a beautiful place, and we do kind of feel like we're in this special nook in North Carolina, but we certainly have a global society, and that is very true even in our beautiful mountain area. So I think that we're doing everything we can to try to limit the spread of this virus locally, and of course asking the public to help us with that, but we are certainly not immune to having more cases.
How are you guys as a health system handling this? How are you preparing? I have several questions on how it's affecting you all, but how are you preparing and what are you seeing?
We are working a lot with partners. Public health, we like to say, is everywhere for everyone, every day. And it certainly is evident in this case. Can't turn on the news or talk about COVID-19 without thinking about lots of different scenarios. So we have been doing a lot of meetings, preparing. Of course, we're practicing our social distancing now and doing them remotely, but a lot of discussions about vulnerable populations and how we protect those folks. And then what we're doing to message things to the public. We want to provide clear messaging as often as we can so that we give people, action steps that they can take to help protect our community.
So I guess that's a good thing to ask you is, what messages would you want to send to the public, the people that are watching this? What message do you have?
So we know this is a difficult time, and I certainly can say, we are all adapting rapidly, and what we say at AppHealthCare is we are leaning into our resilience and trying to do what we can to rapidly expect things to change. And I would say, we want you to practice prevention measures. This is not the time to drag yourself to work. If you're not feeling well, we want you to stay home. Obviously, teleworking as much as possible is what we want to see happen. We also want people to do things like wash your hands. I know we've heard a lot about that, but it is simply one of the best things we can do is wash our hands frequently and train our family members to do the same. Making sure we're coughing into our elbow instead of our hands, and avoiding touching our face. And I'll just tell you, it's something that I do all the time. It's hard to be vigilant and make sure you're not doing that, but we want people to try to avoid getting this so they can do some of these things to try to help themselves too.
You hear bits and pieces of information about how COVID might be affecting the community. I've heard there's 3 cases. Is there any additional information out there that you know of that you would want to share with the community?
Sure. So as of today, we are about to announce that we have a fourth case. And I will say all of our cases are either travel related or it's a direct connection to someone who is a confirmed COVID-19 case. So we don't have evidence right now of community transmission, meaning it's widespread in the community in our area, but we do know that that's happening in North Carolina and in other states that surround us. So we are trying to prepare as if we do have community transmission. So that's part of the reason you're hearing more about social distancing, or really what we mean is physical distancing and keeping people at home as much as we can, because we know that doing those things will help protect more of us, especially those who are more at risk for severe illness.
Do you have any idea how long this is going to last?
I wish I had a crystal ball, but I would say the hope is that it will last longer, but perhaps have a less impact over time. If we don't do what they say, flatten the curve, we could have a very short time, but we could have a very big impact on our local hospital system. We know that that is going to be very important, that we try to protect as many lives as we can. And we want this to last longer and have a lower impact overall than we want it to peak and have more people die. And I think that is one of the things that's very challenging in this, because it's very disruptive, and we understand that. So, as much as what we can get people to just help us in this, that is really what's critical, because it's about saving people.
Is there anything you can share to help communicate the kind of the gravity of the situation or the seriousness of this? A lot of people saying it's nothing, it's just the flu like type of disease or whatever. Any thoughts there on how to communicate the seriousness?
Yeah, I think that I would say I was one of those in the early days. But what we see now is that there are younger people in not just in North Carolina, but in our whole United States. We're seeing more cases, and they're ballooning. Really, it's growing so quickly. Even if you just look at the North Carolina case count, it's gone dramatically up just in the last few days. So I think it's more about just trying to do what we can to prevent the spread of this.
You've been in this community for a long time. I believe you're a Watauga County native.
Mhm.
So you're really familiar with us as a community. Do you feel like we will be different as a community as a result, and how so?
I think the one thing about Watauga County is we have a lot of great people, and this is a time, I think the Silver Linings feature that's coming out in the Chamber newsletter is a good example of that. A lot of great things are happening, even in the midst of this very hard time. We're seeing people step up. We're seeing, different groups offer to help. And I think that is really amazing. So we're going to lean into that difficult space and help each other. And I do hope that we lessen the impact. I will say one of the analogies that I've heard by an infectious disease doctor that I really loved was thinking about comparing this to a hurricane. We see a category 4 or 5 hurricane coming, and what we want to do is try to lessen it to a category 1 or 2 by practicing some of these social distancing things.
Have we seen an uptick in patients either with respiratory issues or people concerned that they have this or anything like that?
Well, we've been getting a lot of calls. Our staff, we have a telephone triage team who are taking telephone calls, and we do have a mix. It's about half and half. Some people who are sick, who have a fever or a cough and really want to know, hey, do I need to be tested? And the other half being really more just general questions about their risk or perhaps their travel history, but they don't have any symptoms. So we've been walking through that. Our nurses have been taking a lot of calls. We have nurses on call 24/7, so people can call us, even during the night if they start to feel bad. We do encourage people to call their doctor or to call us if they want to talk about their symptoms. We've been testing quite a few people, both us and Appalachian Regional Healthcare System. And this week, in fact, our strategy has sort of shifted away from testing so many people and really more towards encouraging people to stay home if they're sick. And the reason for that is because we want to protect our healthcare workforce, and we want to preserve the personal protective equipment that is so important for the frontline healthcare workers, the nurses, the healthcare providers who we really have to rely on. And I would say in particular our hospital staff, we want to make sure that we're protecting them for the long haul. If we have people who need hospital care, we want to make sure that they're able to, have the best opportunity to meet that demand. And that is part of the reason that North Carolina is shifting gears away from encouraging people to come and get tested and more towards calling your doctor and really talking to them. If you have milder symptoms, even if you have a fever and a cough, unless you have trouble breathing or you're confused, maybe you have bluish lips, obviously those are danger signs, and we want someone to certainly get medical attention right away if they have those signs. But otherwise, stay home.
Yeah. That was one of my questions too, was regarding the equipment. Do you guys have what you need? Do you feel prepared in that way?
Well, we have what we need, and I would say all of us are, we're doing what we can to preserve our supplies.
Mm-hmm.
Our staff need gowns and gloves and face shields or goggles and masks, and it's challenging to think ahead about how much we might need, but I will say our local emergency management has been a resource for us, and they are putting in requests for additional supplies, and it's still limited at best across our whole state. So we're trying to think ahead, and I think all of us really use these strategies to preserve our supplies and help protect our workforce as long as we can.
What should we do if we feel sick?
If you feel sick, you can always call your doctor and talk to them, but I highly, highly encourage you not to show up at the emergency room. We want you to stay home as much as you can. The difference in this COVID-19, if you have it, there's really no clear treatment. It's not like we have a clear path and we can say today, oh, we can give you this medicine and it'll make you feel better. It's about self-care, rest and fluids and fever-reducing medicine, and your doctor can guide you best in what they recommend for you particularly. And if they think that you need more care, obviously they can tell you that, but we're encouraging people to stay at home. And if you have the ability to separate yourself from your other family members, have a sick area, so to speak, then that's always good too. If you can have a place where you are sort of putting yourself away from others in your family to try to limit the spread in your household.
Mm-hmm. Yeah, that makes sense. Okay, well, that's all really good, important stuff that I'm glad you were able to share with us. Did you have anything else you wanted to send message-wise to folks before I let you go?
Yeah, I think the only other thing is that we recognize this is challenging for everyone, and we are appreciative of all that's happening, and all of the individual actions to what people are doing to try to help meet basic needs. It's really amazing to see. And I will say one more time, if you're at higher risk for severe illness, you're 65 and older, if you have a compromised immune system, or diabetes, heart disease, lung disease, kidney disease. Those are concerns that really give a whole lot of emphasis towards your action to stay home to the greatest extent you can, because it's not that you're at higher risk for catching the virus, it's that you're at higher risk if you do contract the virus to have a more severe case of it. So we just want you to be safe and stay home as much as you can.
Okay, well, thanks for all you're doing, Jen. We are lucky to have you in that position, and we wish you the best.
Thank you.
And maybe we'll check back in with you in another week or so.
Okay, sounds great. Thanks, Matt.
All right, thanks. Take care.